morning. Hi, Mr. Smith.
Good morning.
My name's Deb. I'm going to be your nurse for today.
Thank you, Deb.
I just want to double check your name and date of birth, and then we're going to get going with things.
All right. Peter Smith,
Mm-hmm.
June 10th, 1962.
June 10, 1962. I have the right patient. Can you tell me your allergies?
I actually have an allergy to betadine.
Okay. And what happens when they put the betadine on?
I got a rash. It gets really itchy.
Oh, okay. All right, very good. Well, I'm just going to do a quick head-to-toe assessment. We're going to just check you out, make sure you're still doing well. Okay, good. Now, I heard they said in the past you had some like rapid heartbeat at home. What happened with that?
Well, sometimes when I'm tired or I've had a real busy day, I would sit down and because I'd feel a little winded and I'd feel what do they call them? Palpitations. It's like a really fast beating. I felt like my heart was beating out of my chest.
And how long would that last? Would it be like minutes, 2 hours, would it last for days at a time?
Well,
how long would it last?
It started about 6 months ago, and it was only lasting about a minute or two at a time, and only, once or twice a week. But as time went on, it became progressively worse. I told my doctor about it, and he followed up, and here I am.
And here you are. Okay, good. If you get any feelings, your heart rate is a little bit irregular. If you do get any feelings of, if it starts to get rapid again, anything like that, shortness of breath, I just want you to let us know, okay?
Okay.
I'm just going to check your feet and look for any swelling. All right. Is there anything I can get for you right now?
No, I think, excuse me.
You coughing anything up at all?
Back again.
Are you coughing anything up at all? Or is it just a dry cough?
No, just oh no.
Oh no, what's the matter?
I'm getting that feeling again.
Yeah, I notice your heart rate is up quite a bit.
Yeah, I'm feeling that fast beating.
Yeah. Anything else you feel with that? Any shortness of breath? Any dizziness?
No, but it really got worse when I walked around at home.
It did.
I don't want to get out of bed. You're
No.
not going to do that, are you?
Oh, no. I want you to stay in bed while you're feeling like this. I'm going to just check your blood pressure one more time. All right, it is a little bit lower, not too bad. But you're not feeling any dizziness or anything like that at this point?
No, not that I can feel.
You seem a little short of breath.
Yeah, a little bit of a cough. It seems to be bugging me a little bit.
Okay. I'm going to give the doctor a call. We have the PA is on covering for our surgeon, so I'm going to give them a call and we'll see what we can do for you, okay?
Okay.
In the meantime, your call bell is right in your hand, and I want you to call me immediately, and I'm going to be right back, okay?
All right. Am I going to be okay?
We are going to do everything we can to get your heart rate down and get you feeling better, okay?
Okay.
All right, I'll be right back. You have your call bell.
Hi, it's Teresa.
Hi, this is Deb up in Cardiac Surge. How are you?
I'm good, thanks.
Hi, I'm calling you about Peter Smith, 53-year-old patient of Dr. Jones, who status post mitral valve replacement 3 days ago.
Sure.
He's got a history of rheumatic fever and palpitations at home.
Okay.
And initially when I went into his room, he was in a sinus rhythm in the 70s with a pressure of the 120s over 60s. But during the assessment, he started coughing and he flipped into a rapid AFib. And he said it felt like it was when he was at home. Rate was anywhere between the 140s and 150s with a pressure of 120s over 60s. I did note some shortness of breath when he was talking. He denies any dizziness or any other symptoms, and he's a little bit concerned. And I was just wondering any orders you want to give me.
Okay.
And where we can go from here.
All right. Thanks for the report. I think let's start with a 12 lead, and I'll be down to assess him as soon as I can, and we'll go from there.
Okay, great. I'll let the patient know. Thank you so much. Bye-bye. All right, Mr. Smith. I did call the PA who's on call for your surgeon, and she's going to come down and she's, here
Hey,
she
Deb.
is. Hi, how are you?
Hi, Mr. Smith. Deb
No,
called me
thanks
down.
for coming so quickly.
Yeah, no problem. What's been going on for you?
I don't know. I mean, I had the surgery. Everything was going well. I was being checked, and I had a little bit of a cough. And next thing I know, I felt that racing again. And I thought, oh, here we go again.
Okay, and that's kind of how you ended up here, is that correct?
Yes.
Okay, great. And so this time it felt the same as it has previous?
Yes, except it's definitely not going away this time.
Okay, all right.
I do have the 12 lead.
Okay. I mean, it's looking like AFib, but let me take a listen to you.
Okay.
I'm going to take a listen to your heart and your lungs, and I'm going to check your pulses also. Is that okay?
Okay.
Great, thank you.
Okay, thank you.
So no chest pain though?
No.
Okay.
No, just that rapid heartbeat.
Okay.
And you were complaining of a little shortness of breath before.
Yeah, if with the pain it hurts.
Okay.
The incision, it hurts a little bit.
Sure.
If I have to urinate, I'm kind of concerned. I mean, I've been using the bathroom on my own, but if I have to get up with these palpitations, they really wipes me out.
Right. Okay, well, we think we know what may be going on based on your exam and based on the EKG that we did. We think it might be atrial fibrillation.
Okay, I've heard of that. Mm-hmm.
So it's an irregular heartbeat, and we're going to talk about how to best approach it for you, because every patient is a little individual in terms of their risks and different medications they're on. So we will get back to you in terms of what we're going to plan.
All right, does that mean I'm having a heart attack?
No, it's not a heart attack. That's a great
good,
question.
good.
It's just an irregular rhythm. Sometimes they happen spontaneously. Sometimes they happen in relation to other things that are happening with us.
I see. Okay, that makes me feel better.
Great. Okay, so we'll get back to you soon.
Okay, thank you.
Okay, Peter, we'll be back, okay? But you have your call bell. If you need us before we get back, just let us know, okay?
Okay,
Ring for
thank
me?
you.
Thank you.
Great.
Yeah, good. All right.
Excuse me.
Yeah,
Are you pharmacy?
I am.
Hi, I'm Teresa Reef. I'm one of the PAs
Michael
on
Thomas,
the
good to
cardiac
meet you.
floor.
Oh,
Oh, you
okay.
too.
Yeah.
I'm just wondering if I can run something by you.
Sure.
I have a 53-year-old gentleman who's 3 days status post mitral valve repair, who earlier today, just a couple hours ago, started in a rapid AFib.
Okay.
So I was trying to think about what to do for him.
You want to cardioverse him, or do you?
Well, I initially thought about cardioversion, but it sounds like this is not new onset, and that he's had
Okay.
it kind of on and off for the last
So
6
you maybe
months.
want to rate control him, give him some
Yeah.
anticoagulation?
That
Okay.
would be great.
What's his past medical history?
So really, nothing terribly significant.
Okay.
He just had the mitral valve repair. His rate right now is 140s to 150s. His
Okay,
blood pressure
okay.
is about 100 over the
Okay, so
60s.
he's okay. Do you have him on any EV nodal blocking
I
drugs?
don't right
orally?
now.
Okay, okay. Well, we probably should do some diltiazem. Do you have a
Okay.
weight on him?
He's about 90 kilograms.
Okay, so we'll bolus him. I think we'll probably just give him 20 milligrams.
Okay.
Yeah, so give him 20 milligrams IV, and then we'll start a drip and then do the heparin protocol.
Okay. That
Okay.
would be great. Thanks a lot.
All right, sounds good.
I will see him and let him know what the plan is.
Okay.
And then maybe sometime later on, if you get a chance.
Yeah, I'll swing
or-
by. I'll
okay.
swing by in a little bit.
Great.
And see. Who's the nurse? Do you remember?
It's Deb.
Okay. All right.
Okay.
I'll chat with Deb too.
Okay,
so.
great.
All right,
Thanks so
Teresa.
much.
All
I
right,
really
thank you.
appreciate it.
All right.
Okay, Peter, I'm just waiting to hear back. I talked to the PA, like you said, and she came by, so we're waiting. Oh, and here she
Hi.
is. She can give us an update on what our plan is.
Hi,
great.
Mr. Smith.
Oh.
We reviewed your EKG
Okay.
as well as your physical exam, and I talked with pharmacy, and we agree that what we need to do right now is some rate control. So we're going to give some diltiazem. It's a calcium channel blocker, and it will
Okay.
slow the rate of your heart, which will make you symptomatically feel better.
Oh, good.
Okay?
I really don't like this feeling.
Great. Yeah, no, we really want to get it fixed for you, and that will help in your recovery as well.
Okay.
So Deb is going to take care of that for us.
Okay.
Pharmacy may be by later to check on you just to make sure that everything's going well, and we'll continue to assess you through this post-op period as well.
Excellent. Thank you so much.
You're very welcome. Any questions?
Not at all. I'm just really glad I'm not having a heart attack again.
Yeah, no, not at all. And it can be concerning, but it's something that we can fix.
Okay.
Okay? Great. Have a good rest of the day, and I'll be back a little later.
All right. Thank you
All right.
again.
Okay,
Thanks,
great.
Deb. You
She
have
said
some?
diltiazem. I've got
Okay.
it. I see your order. Perfect.
Okay, great. Thanks.
Thank you. All right, so we're going to give you the diltiazem. And this, again, is going to just slow your heart rate down. We just
Okay.
did blood pressure just a minute ago. It was 110/65, so that's perfect. Because this is going to
Alright.
slow your heart rate down and make you feel a little bit better, okay?
Am I gonna feel another needle?
Nope, this is going right into your IV. You're not going to feel a thing,
Oh, good.
okay?
Okay.
All right, great. We've given you some of the diltiazem. The name is cardizem, you may have heard. It's
Okay.
slowing down your heart rate. It's done a nice job. It's down to about 110 right now. That's great.
I'm feeling much better.
Your pressure's come up a little bit too.
Oh,
So it looks like hopefully we'll get you feeling better soon.
Hey, Deb.
Hi.
How you doing? You,
Good, how are
Mr.
you?
Smith?
Yes, sir. Hi.
How you doing? I'm Michael Thomas. I'm one of the clinical pharmacists here.
Hi, Michael. Thanks for coming in.
Oh, sure. I just want to check and see how you're doing. You feeling any better?
Much better. Those rapid heartbeat feelings in my chest are gone, which is, that really was concerning.
Yeah. Looks like your rates come down a little bit. It may take a little while, and I expect your rate to still come down a little bit, but let Deb know if you have any concerns. If you don't feel right or if you get dizzy or anything like that, you let her know right away.
Okay, is my heartbeat always going to be irregular like this, or will it ever go back?
It is possible that it'll be that way, but that's something that we can manage. There's
good.
medications that we can give you to help you with that. It's also possible to go back into a normal sinus rhythm, so go back into a regular rhythm, which is what we hope for.
Okay.
That's certainly what we hope for. And what happens here is this is controlling your heart rate enough where your normal body may actually convert you into a normal sinus rhythm, but we'll have to wait and see how that goes.
All right. So
Okay.
even if it doesn't, I'm not going to get that really tired feeling when I have to get up and exert and walk
No.
around.
So what we'll do is we'll give you a medicine that will help to control your heart rate. Something we'll give you in a tablet form, and that should help make you feel okay, even if you're in this rhythm. Okay.
Oh, thank goodness. Okay.
All right. You've been through a lot these last couple of days, but we'll keep a close eye on you. Okay.
All right. Thank you again. You guys have been fantastic.
All
with
right.
this.
No problem. You take care. Have a good one.
All right,
All right,
thank you
bye-bye.
so much.
Thanks. Bye bye.
Take care. All right, sound like a good plan?
So much better.
Oh, good. I'm glad to hear it. Your heart rate's much better, your blood pressure looks a lot better. If there's anything that changes or you feel a little different, you just let me know, okay?
Okay, and please do me a favor. Tell the cafeteria that their food is fantastic.
I certainly will. Thank you so
Thank you
much.
so
All right,
much.
we'll talk to you later. You have your
Bye-bye.
call, Bill.